Hi, Howard Gill here again with the General Agency, and today I will be going over a short video on the top 5 most common health insurance claims problems and how to avoid them or correct them. I know health insurance is never a fun topic on YouTube, but we'll try to make this a little bit entertaining, and we'll kind of go from there. The first thing we need to do is understand the claims chain, the process in the chain, and find out where the causes are for the claim problems. A lot of times it's just a communication issue that can be resolved, but let's go ahead and get started, and I'll show you the chain and how the claims process works. Okay, so the first part of the claims communication process is when you present your ID card to the doctor's office or the hospital. The second thing that happens is the doctor's office or the hospital pre-certifies your coverage or calls it in, make sure that everything's okay with your coverage. Next thing that happens is the patient receives a treatment. Then the doctor's office or hospital creates some medical records. The doctor's office submits a claim to the insurance company. The insurance company then reviews the claims. Sometimes this is done completely by computers, by a computer-generated algorithm, and sometimes it's actually a physical person reviewing the claim. The insurance company will then send an explanation of benefits to the patient, and then the claim is processed. So these are the steps in the claims flow process. Okay, so the first part in the claims process, when you present your insurance card to the doctor's office, a lot of times the patient coordinator may be unfamiliar with your insurance company. They'll look at the insurance card and say, I'm not familiar with that company since it's not one of the major 4 or 5 insurance companies in the area, and they don't know how to file the claim. A lot of times these, we shouldn't call them off-brand, but the less known carriers, what they do is they contract with a network. For example, a PHCS network or a HealthSmart network. Normally, if you flip over your card, it'll have the logo of the network that they're using on there, and the patient coordinator, in most cases, knows how to access those networks. So that seems to be a common problem for some reason, but make sure that when you present your ID card, you know what network you're on, and you can communicate that to the patient coordinator. Along with that same lines, when you're presenting your card to the patient coordinator, sometimes they may be taking a specific insurance company, but there's multiple networks inside of that insurance company. And they may say, oh, we take the PPO, but we don't take the HMO. Well, that may be what they were told or what they believe, but the best thing to do is to go back and look at the network that is attached to your health plan. And if it is an HMO, for example, pull it up, identify that the doctor's in the network, make sure your doctor's in the network before you even go, and then you can say, no, here it is, you do take the HMO. This is a very, very common problem. It's the patient coordinator is unfamiliar with which networks they're in, even though there's multiple networks with the same insurance company. And I know that may sound complicated, but it's very simple. Just identify your insurance plan, make sure that the doctor is taking that specific part of the network for that insurance company. The other thing that happens is the patient coordinator may not understand your health insurance plan type. For example, there's the HMOs or PPOs, but there are other insurance policy types out there. For example, a reference-based pricing plan. A reference-based pricing plan, they use Medicare as a benchmark, and a lot of times the reference-based pricing plans do not have a network since they pay straight off of Medicare. So if you have a doctor's office that's refusing and saying, hey, no, we don't take this insurance, step away from the counter, flip your ID card over, look at the back, get the 800 number to the customer service office, call the customer service office and say, hey, I'm having a problem at this doctor's office saying they're not taking your insurance, and then hand the patient coordinator the phone, and the insurance company will explain how to file a claim with that specific insurance company, and that helps like 90% of the time on the reference-based pricing plans. So understand your plan. If you have difficulty understanding your plan, the best thing to do is contact your HR department or contact your broker. Now, your broker should be familiar with your company, your plan. So some of these smaller brokers are real hands-on. So if you have a broker that is a real small brokerage firm, they normally understand your group really well. They understand what's going on with you and what's going on with the medical conditions. They are a great resource for you just to call them and say, hey, I'm having a problem here or there. What do I do? And they can walk you through the process. So that's the number one. And I know that was kind of long, but we're going to go on from here. Okay, the second biggest problem is the doctor's office or the hospital cannot pre-certify your coverage. The patient coordinator cannot confirm this with the insurance company, and they call the insurance company and they're saying you're not covered. There's a number of causes for this, and a lot of them are very, very simple. During the enrollment process, this is the most important thing you can do, is to make sure that all of the information is correct. If the information on your employee application is wrong, then the system will kick it back as a mismatch and say, hey, this person's not covered. And a good example is bad handwriting. We get this a lot where people fill out their applications quickly and they don't have very clear handwriting, and the person that's inputting the information in the system mistakes birthdays, for example, or social security numbers. I had a situation one time where the pharmacy continued to rejecting a claim all the time. And we're like, no, this is correct. We call the insurance company. Insurance company says, hey, they're covered. Pharmacy says they're not, back and forth. I personally drove out to the pharmacy and said, hey, I have the insurance company on the phone. They're saying they're covered. What's up? The pharmacist actually had the date of birth in their system wrong. So when they were submitting the claim to the insurance company, it was coming back as not covered. So sometimes it could be a facility that has your wrong birthday and not the insurance company that has the wrong birthday or social. So it's important to make sure that those are correct and legible when you're submitting your application for your insurance. I'll put an example up on the screen of what I've seen in the past week on a bad birthday. I shouldn't say it's a bad birthday, but it's an illegible birthday, and you can take a look at that. The other thing is that sometimes your employer will have an onboarding system, and if you typo something in there incorrect, birthday, social security number, sometimes even a name, if there's a typo, the typo system will kick it out too. So on this particular problem, a lot of times it's just the communication when the group your health insurance is set up in the beginning. So let's make sure that everything is correct there. If you are having that problem, the best thing to do is contact your HR department and make sure that all the information that was submitted to the insurance company is correct. And you can also contact your broker, who can also make sure that your information is correct. And then if that still fails, go back to the provider or the pharmacy and say, hey, they're saying I'm covered, you're saying I'm not covered. Can you please check the birthdays and social and so on? And that normally helps that problem. So that was number 2. Okay, the third most common problem is a doctor's office submits a claim. It's a CPT code mismatch. So if your doctor, for example, you go into the doctor for a cold, and when he bills it, they're putting in what they call a CPT code. When they're putting that code in that generates the claim, if they put the code in incorrectly, it will reject the claim. So in other words, if you go in for a cold, and next thing you know, the CPT code says that you're going in for some kind of toe surgery or something of that nature, when the insurance company or the system receives the claim, it'll say, wait, we're rejecting this claim because the codes didn't match up for what the initial procedure was going to be, or the initial CPT code. So it's very important to check that. Also, the hospitalization pre-authorization. If you're at a hospital, what they'll do is they'll call and they'll pre-authorize a hospital stay. A lot of times you'll go in for an outpatient procedure, and the doctor will say, hey, let's change this to an inpatient procedure. And when that claim gets to the insurance company, they're going to say, no, we're not paying for an inpatient procedure when it was pre-certified as a outpatient procedure. What will happen there is that the doctor's going to have to go back to the insurance company and show medical necessity that says this is why we changed it to an inpatient procedure. But that happens, it's common, because you may have the surgery on a Friday. It's supposed to be a simple in and out procedure, and it wasn't. There may have been some complications or something of that nature. You're there overnight, the insurance company is closed, they didn't do the pre-cert, and the claim will be rejected. And if that's the case, once again, go back to your doctor and say, hey, the claim's been rejected, and we need to show medical necessity. Now, a lot of times these problems are actually handled by the doctor's office or the hospital. So if you're getting an EOB, an explanation of benefits that says, hey, something was rejected, that's probably what it is. Just make sure you're communicating with the attending physician at the hospital to make sure that the claim is filed correctly. So that was number 3. Now let's move on to number 4. Okay, number 4 is, once again, the CPT code mismatch. I preach this a lot because a lot of times these claims are filed electronically, and the computer system will spit them out and just automatically reject them. If you're getting that rejection, then that's normally what it is. It's a CPT code mismatch. Make sure you contact the doctor's office and make sure it's filed correctly, and that will happen. All right, let's move on to number 5. On number 5, it's when you get your explanation of benefits. You'll look at your explanation of benefits and say, hey, from my understanding, all of this was supposed to be covered in the doctor's office. And sometimes it's not. The doctor's office, some health plans will say, hey, we're going to cover the doctor's office visit itself for a copay of like $35 or whatever. But if the doctor is doing treatment in the office, let's say that they're stitching a finger, that's a surgical procedure and it's classified as treatment. Sometimes, even though you're at the doctor's office, you paid your copay, the claim may come back as deductible and coinsurance because the doctor is providing a treatment to you, basically a surgical procedure, and that's going to fall under your deductible. So make sure you understand your plan and understand how that explanation of benefit works. And it should say on there, if you have any questions, be sure and contact your broker and say, hey, I'm being billed for this or that. But any time you have something on your explanation of benefits that doesn't look right, the best thing to do is to call your broker. Now, another thing that happens periodically in this, it happens when you're changing from one health plan to another health plan, even inside of even within the same insurance company, you may end up in a situation where your drug was covered as a formulary drug, or as a brand name drug was covered under a certain copay. If you've changed plans, sometimes those copays have changed. So you may say, okay, now it's a non-formulary, or now it's falling into the specialty category, because the list of pharmaceuticals, sometimes they shift inside of what they call that formulary list. And that formulary list, it may be a tier 1 drug, tier 2 drug, tier 3 drug, depending on your formulary. I know that's kind of complicated too, but basically what that's saying is if it's going to fall under generic, brand, non-formulary, or specialty. And sometimes it just flat out won't be covered. So make sure that when you're changing plans, if you're on any medications at all, make sure that drug is inside that formulary, or see if you can just stay on the current plan, or talk to your employer about that. So those were the normal 5. Now, a couple of things that can happen during this claims process. Whenever you're dealing with a claim, the best thing to do is try to find out where the source of the problem is. Is it the doctor's office who's misfiling the claim? Is it a pharmacy that doesn't have the right date of birth, or is it the insurance company that doesn't have the right date of birth or social? We just need to find out where this communication problem lies. Now, the best way to do this is to contact your broker, and I can't stress enough how important knowing your broker is, who he is or she is, and having the ability to contact them. Because if you're getting in a situation where you are dealing with, for example, a large brokerage firm, and I'm not calling anybody out on this, but if you call your the insurance brokerage's office and you're getting a different person every time, it's difficult because they don't understand you, your situation, and what's going on. So having a broker that is familiar with your group or your individual policy is super important, because that person is there to help you. That's their job. And so make sure that you contact them and your HR department and make sure that those things are squared away. So that's basically it for the claims. I know it's kind of dry and kind of boring, but make sure you hit the like and subscribe button, because obviously this is not the most exciting video ever. But so all the likes and subscribes that I can get helps me out here. So anyway, with that, I hope you have a great day. My name is Howard Deal. I'm with the General Agency, and I'll be doing another video soon. Thank you very much.